talk about my ICMR project, which was on the prevalence of sensory neural hearing loss among medical students who are chronic mobile phones and earphone users. I would like to ask each and everyone here one question. How many of you guys has had panic attacks every time you drop your phone? Can I have some hands? No, I can't be the only one. Okay, what about how many of you guys have been paranoid every time you think you lost your phone? We frantically search for it, right? So, and how many of you guys, so we use our cell phones every day to either to call someone or listen to music. We have it all the time with us. But how many of you guys are aware of the harmful effects it has on us daily? As you know, so it is just not us. It is 70% of the world population are dependent on cell phones. So we are literally tied to our cell phones. So, as you know, hearing is a natural phenomenon that is fully developed at birth. But as we get older, it is supposed to decrease. But due to the constant usage of cell phones, either in the way of calling someone or listening to music, we have hearing loss in the form of sensorineural hearing loss. So our primary objective in doing this study was to assess the prevalence of sensorineural hearing loss among medical students who are chronic mobile phone users and earphone users. Then our second objective was to assess the type of hearing loss, as it is sensorineural hearing loss, or the degree of hearing loss, if it was mild, moderate, or severe, as well as the associated symptoms, as in the perceived symptoms the individuals felt due to the constant usage of these items, that is personal listening devices. So as I said, my title is chronic users. So what do I mean by chronic users? As in chronic users, we took the definition as an individual who uses cell phones either to listen to music or to call for more than 1 hour per day. So the study was done among medical students of Dr. Somerville Medical College in Trivandrum, Kerala. So what we did was, after getting ethical committee clearance, we gave out questionnaires. That is, 455 questionnaires were given out to the medical students of 2012 to 2016 batches, which was done in a cross-sectional manner, and the study duration was about 10 months. The individuals that were excluded from the criteria were individuals who had history of ear discharge, or if they already had any hearing losses, or if they were already detection of sensorineural hearing loss previously, or if they were taking any orthotoxic drugs, or if they were exposed to loud noises other than cell phones or earphones. And so, as I said, we gave out questionnaires. The questionnaire had 3 sections: Section A, Section B, and Section C. Section A contained the socio-demographic details of the students, that is, their name, age. Then Section B contained questions relating to the use of their cell phones or earphones, as well as the perceived effects or symptoms they thought they had, that is, lack of academic performance or lack of concentration they thought they had with the usage of it. And Section C contained details on the evaluation of sensorineural hearing loss. That is, if they thought they already had sensorineural hearing loss, or individuals, as I said, Section C helped us to exclude the individuals, as it gave us an insight on if they were using orthotoxic drugs, or if they had otitis media, or anything as such that would result in this hearing loss that was not induced by the cell phones or the earphones. So 455 individuals were taken for the questionnaires were given, and out of that 420 were included in our study. Out of the 420, individuals were categorized into chronic users as well as non-chronic users. And the chronic users, that was 120 individuals, was taken into the ENT department, and they underwent pure tone audiometry as well as autoacoustic emission testing to find out if they had any sensorineural hearing loss. And the data was analyzed and entered in Excel. And going on to the results for the socio-demographic characteristics from the questionnaires were females were more in proportion, that is 65% compared to males being 35%. So as I said, there were chronic users and non-chronic users. The chronic users being 44% of them were chronic users, while the non-chronic users were more, being 56%. So the section B of the questionnaire contained the symptoms and effects that the students felt they had, and the most common symptoms or as in following the individuals for prolonged years to assess their hearing loss would be a better idea to do. Thank you so much.
Your study was to find out what is the prevalence of sensorineural hearing loss among chronic mobile users. What is the sample size?
455 was the sample size.
Chronic mobile users were only 120. The sample size is 120.
No, sample size was taken as 455, and out of that, individuals were categorized as chronic and non-chronic.
Your study is on chronic mobile users.
Yeah.
Correct. Prevalence of sensorineural hearing loss in chronic mobile users. And there were 120 chronic mobile users.
Yes, sir.
So sample size is 120.
120 was they
Chronic
were
mobile.
gotten from the questionnaire. So the questionnaires we distributed was 455, and we had to assess if they
If
were
I
chronic
want to
users or not.
estimate, okay, what is the prevalence of the diabetic foot ulcer among diabetics? Okay, I go to a ward. In a ward of 100, there are 50 diabetics. And out of 50 diabetics, 10 are having diabetic foot ulcer. Correct. So my prevalence, what is the number? What is my sample size? My sample size is how many diabetics are present, not how many patients are present in the ward. So in the similar fashion, here your sample size is not who are the total, how many people are using the mobile phone, how many people are using chronically the mobile phone, or how many are chronic users of mobile phone. Because your study is targeted at them who are chronic mobile phone users. So if you go by that, your sample size is 120 because there are only 120 chronic mobile phone users. Otherwise, you need to change it as among the mobile phone users and then classify them as chronic and non-chronic.
What was the questionnaire? Is it a standardized questionnaire?
It was a self-structure.
How was it validated? Validation of questionnaire.
It had 3 sections. Section A contained just a social
Validation is that was validation of can you use a tool to determine who is chronic or to
Yeah,
determine who is
it had a question that contained how many hours of usage of cell phones they did, how many hours as well as daily how they did. So for mobile phones, it had one section. For earphones listening to music, it had in the section. So by looking at that, we categorized individuals into chronic and non-chronic.
That's what I'm asking. How do you categorize it and what basis? And this questionnaire has been used in any other like auditory any guidelines are there where
By
you can-
references,
and it also depends on how much decibel the patient is hearing to. I'm using a cell phone, but I'm using a headphone, but I've kept the volume at a very low level decibels.
that was asked
Using this
in
a
the
person who
questionnaire.
has,
That was included if they use low,
how do
high.
you measure it? I mean, it's so subjective.
Another thing, what made you decide 1 hour cutoff?
By the previous studies that was done. So by the other references that I found, they used 1 hour, 2 hour as the cutoff. So I took 1 hour as the cutoff. And 0 to 25 decibels is the normal WHO criteria. So that was considered. And then if anyone had more than 25 decibels as a hearing loss, they were under. That is what we did for the audiometry testing.
Okay, so what is the final conclusion? Does the use of mobile phones lead to sensorineural hearing loss? How much?
Actually, what I did was a cross-sectional study. So in order to get the accurate would be to use a larger sample size, more than just notches including 120.
So you mean to say the methodology that you have adopted was not foolproof to meet the objectives of the study?
The students, what I'm saying is I did a cross-sectional study. By doing a cohort study that is for long years, we would have a better orientation of
What did you get in the current study?
Currently, there is only mild, 5% is just mild sensorineural hearing loss present, which was it.
What percentage of people who are chronic mobile phone users had hearing loss sensorineural? And what percentage of people who are non-chronic mobile phone users had sensorineural?
Total high frequency hearing loss was 5%.
You know, I'm asking for comparison between chronic mobile phone users and non-chronic mobile.
Non-chronic mobile users weren't they weren't subjected to audiometry testing. Only the individuals who had used more than 1 hour, they were the only ones who underwent audiometry testing.
Then how do you correlate this hearing loss to mobile phone use?
they were the individuals who already had hearing loss. There was the exclusion criteria. So if the individuals thought they had hearing loss by other causes other than cell phones, like hearing bad noises, or if they were near firecrackers, if they had hearing loss due to, they were excluded. If they thought they were taking ototoxic drugs, they were excluded from the criteria. If they had acute otitis media, they were excluded from the criteria. So it was solely referring to just the sensory hearing loss due to cell phones and earphones.
Any questions from the audience?
Okay, how many times you had the audiometric test done?
Audiometric testing was done only once.
So you think that that audiometric test room in your college is that soundproof?
Soundproof, the soundproofing only affects the low frequency hearing loss, which is not important for sensory hearing loss, as high frequency hearing loss is what is easily affected if there is sensory hearing loss due to the constant exposure due to noise pollution.
Noise pollution is a main problem in Kerala, right? So you think that doing audiometry once will be a limitation for your study?
Audiometry once is only needed to assess the hearing loss they have at that time. It doesn't need to be done more than it could be done after years and years of exposure. As I said, doing a cohort study would enable us to follow the patient and do a constant audiometry study. But in a cross-sectional study, which is where I have a time limit, I wasn't enabled to assess the increase in the hearing loss that the students could have had, which is why a cohort study would be a better way to do this study.
Thank you.